Hey, welcome to another Fox 411 and Kiss Country Neighborhood News. It's all brought to you by CG Public Health, cghealth.com. They're located out at Plaza West Shopping Center. We appreciate them so much for sponsoring our neighborhood news and our Fox 411 here today. We've got a couple of guests here. We have Wendy Martinez from the Out of the Darkness Walk that's happening this Saturday, October 1st, and the American Foundation for Suicide Prevention. And also Sheila Kolbliska. Did I pronounce that right?
Yes, you did.
All right. Sheila's from the Mitchell County Regional Health Center. And, welcome, ladies. This is obviously a subject that nobody likes to talk about, but it's important to get the word out, and that's why we're here to help people, I guess, really, education, understand, what this is all about. I'd like to just first off just ask you, how do you prevent suicide? How do you prevent suicide? There's got to be a plethora of answers, but what's it come down to? I realize depression, some mental health issues come into play, but I don't know. Sheila, why don't you kick us off on that?
Yeah, I would be happy to. Yeah, there's several things that we can be thinking of and do that can hopefully help prevent someone from taking their life from suicide. The first thing would be to ask them, are you thinking about killing yourself? So often we think, well, if they weren't thinking about it before, they're going to be thinking about it now, and that's not the way it is. And that's not an easy question, but the studies do show that asking an at-risk individual if they are suicidal, it does not increase suicides or the suicidal thoughts. Something else, keep them safe. Reducing a suicidal person's access to highly lethal items or places is an important part of suicide prevention. It's not always easy, but asking the person if they have a plan and removing or disabling the lethal means that can make a difference for them so they're not able to take their life. A third thing is being there. Listen carefully and learn what the individual thinks and feels. Research does suggest that acknowledging and discussing suicide may reduce rather than increase suicidal thoughts. And next, help them connect. Say the National Suicide Prevention Lifeline, and now that number is 988. It used to be a longer number, and they changed it and shortened it. And so have them call that if they are having troubles. They're there if you need them, and you can also help them to make a connection. And lastly, staying connected. Staying in touch after a crisis or after being discharged from care can make a difference. And that also shows that the number of suicide deaths goes down when someone follows up with the at-risk person.
We just had Chief Brinkley on talking about that 988 number, didn't we, Jay?
Yeah, we did.
We do a Crime Stoppers thing once a month, and he was our guest for that recently.
Uh-huh.
How is that going? How is that whole 988 thing going? People are using it. He said it was going well.
Yeah, from what I've heard, it's going really well. It's just a nice thing because people can remember it a little bit easier. When you're in that crisis mode, trying to remember a longer number is not always going to come to you. And now that we have that available kind of at your fingertips, it's a wonderful thing that was able to get pushed forward by lots of entities that were involved in it.
Mm-hmm.
I should mention, Jay, real quick here before you jump in here. September, this month of September. I know we only have a few days left, but it's designated as Suicide Awareness Month, by the way, this whole month of September. So go ahead.
Well, what my question is, and people probably ask this all the time, what are some of the signs that you can notice? Or is there any signs that you can see that somebody might be suicidal?
Do you want to take this, Wendy, or I can? I have some.
Okay. I'll have a few and then you jump in.
Oh, that sounds perfect.
A lot of times people kind of change their, when someone, they change their normal activities. So they kind of withdraw and they just pull themselves back from the day-to-day things that they would normally do. That's a big sign. So kind of just acting out of the norm is a big thing. Giving away possessions is a thing that we hear a lot about. People just start to kind of give things away. Like they're trying to close that final chapter and just hand things out. There's a few there. Go ahead, Sheila.
Yeah, and any prior suicide attempt is kind of a red flag too. They're higher risk for it. Maybe some marked feelings of hopelessness or lack of interest in future plans or not making any future plans. Medical conditions, especially with chronic pain. Someone has some real severe back problems that is so painful for them, and they're told there's nothing we can do for that. Then they're despair from knowing they're going to have to live with that for the rest of their life. Family discord or losses, the loss of someone recently, a close person, that could put them at a higher risk as well. Alcohol or medication misuse or abuse, that can be a big sign too.
Yeah. Let's talk about ages a little bit. Because I mean, let's face it, we all read everything on the internet. We see things on social media about, at least I've read it anyway, that it seemed, especially around COVID time and a little bit later, after about a year of COVID, and you guys can even talk about that, how that didn't do any good. That did not do any good, with, but how about how young? I think people are going to be shocked about, because it shocked me when I read how young some of these kids are that are trying to commit suicide.
I mean, I can talk about the elderly population. Our program, it's a psychiatric intensive outpatient program for elderly people, normally 65 above, some are a bit younger. And throughout COVID, a lot of them were very isolated.
Yeah.
They were not able to get out to do things with family, the loneliness. And we've had a lot of people who have been referred to our program because of that. They just weren't getting out. And when they come to our program, just the fact of being around other people has helped them tremendously. We've been able to do telehealth. That's been a wonderful thing out of COVID for all the mental health therapy. People can access that from their home if they're not able to drive or whatever else it might be. But yeah, COVID definitely affected a lot of those people. And like I said, we've been able to help them. For suicide numbers, 85 and older is one of the highest percentage per population
Really?
of dying from suicide. Yes. Isn't that crazy? I
That
know. And a lot
Yeah.
of times what will happen, I think, is that, maybe they're overdosing on some of their medication, whatever it is. And
Oh.
you just think, well, they're older, we
Yeah.
whatever, they died from old age or something. It's kind of with the depression and anxiety. You think, oh, they're older. That's just part of aging. And that's
Right.
not a normal part of aging.
Wow.
Like I say, we need to put that golden back into the golden years. That's what we're doing. So
Yeah. Wendy, how about the younger ones?
Well, I've seen statistics from, let's say, ages 10, which is pretty young, to 15, Harry, when you bring that up. And it's really hard in our minds to fathom that someone that young can cognitively kind of think and to be able to complete a suicide. A lot of different things play a role in that. There could be some, mental challenges they might have that are kind of underlying. We know that bullying is an issue, and bullying is not always in school. It can be in a workplace. It can be really anywhere. And so with the young, that is a common thing in schools because, let's face it, kids are not very nice to one another. And it's hard to get over that when someone constantly is kind of nagging at you and picking on you. And not to say that that's the one thing that will lead to this. There's multiple factors. It's not just a one and done type of a thing. And then we get a little bit older into our teen years, even a little bit older, and it's the second leading cause of death among our young in Iowa, and like the 10th overall. We're a higher state for it, and it's definitely a public health crisis, and we need to be able to have platforms like this, and we need to be able to talk about it for sure.
Well, and you have people, you talk about the different ages, but also you see people, you got friends and family members as well. And sometimes you wonder what, sometimes they got demons. And so this is strange for me to talk about this because I had a relative that did it and his birthday's today.
Oh.
So it was my wife's nephew. He would have been 30 today. And he did it earlier this year. And it was one of those things. His family, he had a little boy. His girlfriend, fiance had a little girl. And so it affects everybody when it comes to it, friends and family members. And I don't know how you get people out of that state of mind to do that.
Yeah.
to even
Well,
think that way.
yeah. And again,
Well,
you're
I
right.
think
It does affect everybody. And I think everybody has been affected one way or another, from suicide. One thing is verbiage for it. Instead of saying commit suicide, they really would like us to say died from suicide. It just makes it, kind of more human. And it's like, somebody died from cancer. They don't commit cancer, so they're trying to help break down that stigma, even change the verbiage and how we do talk about it. And hopefully by doing that, it will help those who are really depressed or thinking about it be more apt to visit with a family or a professional or somebody else about it.
But talking to him, you could never know that he would even think about it. You know what I mean? He's a happy-go-lucky kind of guy.
Mhm.
I think
So
that happens a lot, Jay, and it's kind of ironic you bringing that up, that we're doing this today, but it's also probably, I would just say, it's fate that it's talking about it now. It brings up some things for you and your family to talk about, but it's hard for, like, I lost a brother. It's been 18 years, and the hardest part has always been to put yourself in their shoes, that they're at the lowest point in their life, to come to that decision. We haven't walked in that directly necessarily, and that's the part that you just, we're humans, we're creatures of habit. Our brains want answers. We want the why and the what could I have done, and you don't get that with this, and that's the hard part, to walk someone out of that. And the couple of things that Sheila mentioned about, different signs to look for, and putting time in between someone who has that suicidal ideation or those thoughts. If you can put time in between that, that's one of the best things you can do, is because you're kind of getting the brain to slow down a bit and changing some course. Not saying that it's going to be a perfect science, but it's very, very helpful.
And Wendy, this is a good time to talk about this Saturday here coming up. But I just wanted to throw in the fact I've been in addiction recovery for 16 years now, and I
Congratulations.
definitely have spent a lot of time putting joy in my life rather than anything else. But I can tell everybody one of the worst demons out there is self-reliance. You think in your mind that you can get yourself out of anything. And the problem is we don't know how to ask for help. And that is the key. And I don't care what it is. I don't care what it is, ask for help. We need fellowship with people. We need to get out of self. We need to get out and enjoy our life with others. Love, care, and serve others. I say it all the time. I mean, it's helped me, and that's kind of my motto. And but I just anybody out there that is alone and needs to talk to somebody, you got to reach out. I've always told people that going through grief or just depression itself is to keep moving. And I don't mean just physically, mentally too. Just keep moving. The greatest thing you could do is probably volunteer and serve others, and get out there. But self-reliance is a demon. It'll get you in trouble. So on that note, Wendy, talk about the Out of the Darkness walk that's coming up here this Saturday.
Well, Harry-O, this is our 16th walk, and I can't believe that so much time has passed to have, so many of these. And it's this Saturday, October 1st. We'll be at Southbridge Mall, 9 to 11. People can check in or register if they haven't registered online already. And then at 11 o'clock, we will have a ceremony. We have an honor guard who'll kind of be there to kind of do a little honor to the military.
Sure.
And then we have a phenomenal speaker coming from the Quad Cities. His name is Kevin Atwood. He's also part of our board through the Iowa chapter of the American Foundation for Suicide Prevention. He also runs a nonprofit there called Foster's Voice, named after his son that he lost. And he is just a phenomenal speaker. He's going to come and talk just for a little bit, maybe 20 minutes or so. And then after that, we will walk over on State Street to John Adams and back.
Oh, very good. All right. And this all starts when? When does you have to,
So you can register now.
Okay.
Yeah, you can register online now up until Friday. I think they cut it off about noon or maybe a little bit later. And then if you don't get registered, then you can register the day of. We'll have some forms there where you can register.
And they register online at the website that people are seeing if they're watching this. If they are listening to it, it's afsp.org/Mason City. Is that correct?
Yes, that is correct.
Go right
and
there.
If you fundraise, and if you raise $150 like Sheila did, because she did her 150, you will get a t-shirt for free. And here's Sheila's shirt here, kind of what it looks like.
Oh,
I love that.
Jay,
And
it's
then we
purple too.
It is purple. And then we have our sponsors on the back.
Oh, nice. Okay.
So it's they're very pretty purple and they're nice and soft. So I have Sheila sitting there waiting for her because she raised her 150. So each walker that does that will get their shirt free.
There you go. That's great.
It's a great cause, Wendy, and it's wonderful that you spearhead it. Hats off to you.
Thank
You
you.
bet.
It is
Yeah.
it is a great cause. We're just trying to, create that education, that awareness out there. Like Harry said, everyone needs to know they are absolutely not alone. I don't care what is going on in your life. Reach out to somebody. We put these events on. I don't care if 2 people show up. If you can help that one person, everything you do is worth it.
You bet.
Yeah.
You bet. And you've had some good crowds for this. If
We
I,
have, yes. Yeah.
I've actually been part. I've usually Saturdays are my wedding days, and I'm usually, but I've always seen. I mean, I've seen you guys down there by the mall, and good job for everything
Yeah.
that you guys do. We need more of you.
Yeah.
Because I tip my hat to counselors, man. I really do, because they really, I counsel myself in different ways, but I those professional counselors out there, I don't think enough of them. I don't think sometimes, because it's tough. I mean, I can't, and we're all human. We're all human, and we all have different things that we think about, and we've all been depressed before. If you've never had a day of depression, well, you're not human. I think everybody has gone through this, and the right way to do it is to get the tools to get yourself through.
I like to say, if I would ever become president, that would be one of my first laws, for everybody to go to therapy at least twice a year, and every married couple at least twice a year. Because really, just to have that third person or whatever it is to listen, it's confidential. It makes me think we had a patient who came to our group, and she just was saying last week, she's been here for about 3 months, and she says, I really didn't think I needed this when I started. But now that I've been coming and I've learned these techniques, I've learned these signs and symptoms, I realized I really needed to come. Thank heavens I did. And like you said, Harry, a lot of time, I don't need it or whatever. But yeah, often when you really get, digging deep into some things, you realize this is the best thing I could have done.
Yeah. Well, I think a lot of people do that wait and see approach,
Mm-hmm.
And that's all part of that whole self-reliance thing.
Yeah.
It's just
Pull up your bootstraps.
Yeah, exactly.
The most beautiful person is a person who lets them show their vulnerable side. That's all it is.
Yep.
You just have to show it, because we all have it, and it doesn't matter. And if we take the stigma away and we take the meanness of people out of the equation, we really could do that. And Sheila for president. Let's vote for her now.
All right. There you go. And then you're VP, Wendy, and then
There we go.
Jay
There
and
we
I'll take care of secretary and treasurer, I guess.
There we go.
All right. Speaking of Speaker of the House, there you go, Jay. Take us out of here.
There you go. So that's our Fox 411 and Kiss Country Neighborhood News. Sheila, Wendy, thank you so much for taking the time to talk to us today on a very serious issue. It's all brought to you by CG Public Health at cgpublichealth.com. For me and for myself and Harry O, Wendy and Sheila, thank you again.
You're welcome. Thank you.